Welcome. My name is Aguilar, and today I'm going to be speaking with you about strategies for developing spoken language with young children with autism. It's nice to have you here. We have a mix of professionals and parents, so today I'll be defining some terms that may be familiar to some of you. We also have only an hour for this webinar, so I won't be able to provide a step-by-step how-to, but I should be able to give you strategies to focus on. Also, at the end of the presentation, we'll have a website available where you can go to get a free trial of Skills. Skills is an online tool that provides comprehensive assessment and curriculum, positive support planning for challenging behavior, progress tracking, and treatment evaluation all in one place. And it has a lot of the information we're covering today in great detail with specific how-to steps. Also, because of time constraints, we only are going to be focusing on the development of spoken language. Obviously, that's just one big part of the bigger picture of communication, but it's a very important part, and it's something that is relevant for children with autism. Today, we will speak about the importance of language intervention for children with autism, conceptual frameworks for speech and language development, and verbal behavior strategies for developing vocal speech, and the use of adaptive and augmentative communication devices, specifically the picture exchange communication system in the development of vocal speech. Children with autism characteristically have difficulty with a variety of language and communication skills. We know that spoken language is a deficit that's in the DSM, the definition of autism in the DSM. The DSM-4 TR specifies that in order to have a diagnosis of autism, a child must have at least one of the following, and it includes a delay in or a total lack of the development of spoken language, not accompanied by an attempt to compensate through alternative modes of communication, such as gesture or mime. The definition of autism spectrum disorders is changing in the next DSM publication coming this year. However, a lack of spoken language and social communication is still a relevant feature of the definition. There's been a number of research studies examining language development in children with autism and comparing it to that of language acquisition in typical children. These studies have shown that there's a tremendous variation in timing and patterns of language acquisition for children with autism. However, most children with autism develop language later than their typically developing peers and at a slower rate. It's very difficult to assess changes in the percentage of children with autism who have spoken language over time, and part of that is because we've had changes in diagnostic criteria. We also have found that the definition of what constitutes spoken language varies over time in studies. However, it is estimated that 1/3 to 1/2 of children with autism do not have functional speech, and 20% or less of children with autism do not develop spoken language. So those are two different studies. Early intervention, however, appears to have a positive influence on language acquisition. And research also shows us that children can develop language skills well beyond the preschool early intervention windows. So if a child still has not developed vocal speech and language, that doesn't mean that they will not develop it in the future. In Howland's research article in 2005, she noted that earlier spoken language acquisition by age 5 or 6 and IQ scores are two factors that consistently are associated with good or very good long-term outcomes for children with autism, which is another reason why language acquisition is a very important topic and focus for an early intervention program. As I mentioned before, spoken language is part of a bigger picture. It's part of communication. It's essential for communication in many instances, especially communication across a wide audience. It's also a key component of play. Children's play is made up primarily of language once they hit 3 or 4. I'm doing this. I'm shooting you with my laser beam. well, I'm blocking you with my ray shield. All of those things, all of the play that they're doing has a spoken language component. And then lastly, it's important for socialization. And we know that these other areas, communication, play, and socialization, are also deficit areas for children with autism. We've found that early predictors of communication development coincide with the development of motor imitation, a development of joint attention. And when we talk about joint attention in this context, we're talking about triadic joint attention, where two individuals are looking at an object and they're aware that each other is looking at the object. It involves typically a gaze or a point or other directive action to that object, and then a gaze shift back to the other person to confirm that that other person is looking. So an example would be a little boy who's noticing the moon in the sky would point up to the moon, look back at his parents to see if they're noticing him and his point, and then gaze shifts back to the moon. And then finally, the other predictor is symbolic play. And symbolic play is playing with an object in a symbolic manner. So for example, using a banana as a telephone. So behavior analysts specifically look at, or specifically use verbal behavior, the verbal behavior model, when evaluating children's language skills, language and communication skills. And the verbal behavior model was proposed by Skinner in 1957. B.F. Skinner wrote a book called Verbal Behavior. And it looks at language and communication from a behavior analytic perspective. And the key component is that language is considered a behavior learned through exposure to environmental stimuli and consequences. At the time that Skinner wrote this, it was actually considered controversial. And the prevailing linguistic models at the time were biological and cognitive. The biological model of language looks at language as an innate biological function. For example, Noam Chomsky, a prominent linguist and cognitive scientist, hypothesized that all individuals are born with an innate neurological ability to acquire language. Specifically, he called this the language acquisition device. He postulated that this hypothetical device allows people of all language backgrounds to acquire the syntax structure of language at an early age. And this application wasn't typically applied to people with disabilities. The other prevalent model at the time was the cognitive model, and that fits with Piaget's approach to language, and it's the concept that language was controlled by cognitive processes. This model is still used today, and aspects of this model are incorporated into teaching programs for children with autism. You'll see many aspects of it in most ABA programs. And in the cognitive model, language is classified by topography, so its form, what it looks like. For example, we talk about expressive versus receptive language. Expressive language being language that is spoken, receptive language being language that is heard. And in the cognitive model, language is measured using traditional linguistic analysis, phonemes, morphemes. We talk about mean length of utterance, and have classification systems for words like nouns and verbs. Skinner's analysis of language lies in direct contrast to this and similar linguistic approaches. Skinner's verbal behavior does not point to any abstract or innate neurological brain structures, but instead to the interactions of the individual with the environment as the most essential component for influencing language development. So the key for Skinner is environmental. In verbal behavior, he states that language is operant behavior or learned behavior, and it's under the control of environmental stimuli. It is a human behavior, and it can be analyzed using the same principles applied to nonverbal behavior. So all the principles of ABA, applied behavior analysis, can be applied to verbal behavior or language. We just will now use new names. And language is classified by function. And also the other key component, as I said earlier, is that language is learned. So in verbal behavior, we talk about something called the ABC contingency, or the three-term contingency. And that's what we see now on the screen: the antecedent, the behavior, and the consequence. The antecedent is what comes before the behavior, and the behavior is what's specifically being analyzed in that instance. And then the consequence is what immediately comes after the behavior. So when we're teaching, we often will talk about an instruction or a discriminative stimulus, an SD, and then the child has a response, and they receive a consequence for that response. With verbal behavior, we're going to be looking at that same concept. It's going to be speech. So for example, we see mama, the child says mama, so the stimulus is seeing mama, the behavior is saying mama, and the consequence is mom gives social reinforcement by responding to the child's words. So the verbal behavior model, Skinner's ideas were researched in the early 1980s as there was an increasing interest in teaching language skills to children with developmental disabilities. And it was found to be extremely successful in treatment of children with various different developmental disabilities, including autism. And during this time, a body of research was developed. Also at this time, many intervention programs in the 1980s and 1990s adopted the verbal behavior label and approached the development of language in a new way than many other existing ABA programs at the time. However, since that time, clinicians have come to understand that the principles of verbal behavior and its irreplaceable value for treating individuals with developmental disabilities and language delays. So at this point, we know that the verbal behavior approach to language is not distinct from applied behavior analysis programs. Instead, it's a vital and primary component to an ABA treatment approach. Before we move on, let's quickly review some terminology. In ABA, we talk about the behavior as anything someone says or does. A reinforcer is a stimulus when added or removed increases the future likelihood of that behavior. So reinforcer typically would be a consequence, and when added, so for example, if Joey is trying to climb the stairs to the slide for the first time, and his mom cheers him on when he gets to the top, in addition to the success of getting up the slide, he enjoys hearing his mom's cheers. So that those cheers are added, it increases the future likelihood of him trying to attempt to climb the stairs again. It can also be something that is removed. For example, if there's an uncomfortable stimulus in the environment, for example, the music's really loud, and the behavior might be, please turn the music down. And when someone requests that the music's turned down, and another person turns the music down for them, that is the removal of the loud music, and that is also can be considered reinforcing. It shows the person, hey, if I ask for what I want, I'm likely to get it. And then finally, as we said before, verbal behavior. And when we talk about verbal behavior in the verbal behavior context, it's any behavior for which the reinforcer is mediated by the behavior of another person. So verbal behavior needs to have another person involved. Which is good because it's looking at communication, and we know that's the important aspect. So verbal does not equal vocal. Oftentimes we'll use verbal to talk about some spoken language. In the verbal behavior context, we use the term vocal to talk about vocal spoken speech. Sign language, gestures, iconic communication systems like PECS and VOCA, voice output communication aids, can all be examples of verbal behavior if the reinforcer is mediated by the listener. So you don't actually have to speak, you just have to have a means of communication. We also know that tantrums, aggression, those can all function as verbal behavior too. In fact, babies engage in verbal behavior almost from birth when they begin crying, and that is an attempt at communication. Some vocalizations also are not considered verbal behavior. So vocal stereotypy that does not have a communicative intent would not be considered verbal behavior. And from this point of view, individuals who do not speak are non-vocal, but they can engage in verbal behavior. In the verbal behavior model or approach, language is classified by function or how it is used rather than its form or topography, like what it looks like, or the actual word label or meaning. So in other words, we're more interested in teaching the various ways that language can be used instead of teaching a specific word concept or increasing a child's vocabulary. This promotes generalization. It increases motivation because the child is getting their needs specifically met, and it's also more meaningful. Because the verbal behavior approach to language development emphasizes the function of language, Skinner developed new terminology for each of these functions. They're also called verbal operants, or operants of language. So there's actually 14 of these verbal operants, and each repertoire is functionally unique, and also each one must be taught. So what we've found through research is that you can't teach a concept, even if you're teaching a word in one repertoire, it's not necessarily going to translate to another verbal operant. And then also the speaker, or expressive, as we mentioned before, and the listener, the receptive, those two skills are different. They're different repertoires. So let's take a look at some examples. When language is used to simply mimic or repeat or echo a sound, or a word or a phrase, it's said to be an echoic operant. And then when language is used to request or demand something, it's referred to a mand. And one great way to remember mand is just remembering the word demand. You're making a request or a demand. When language is used to comment on something or something in the environment, or comment on someone or something in the environment, it's said to be a task. And a social exchange of language, where words are used to respond to a verbal statement or a question, is considered an intraverbal. So that's more like conversation. We'll look at some early intraverbals today. So in recent years, there have been several behavioral language assessments that more closely examine language by function. And it may be helpful to reveal specific target deficit areas requiring intensive intervention to use one of these assessments. All of the following assessments gather information regarding language development according to the verbal operants outlined by Skinner. And they also offer specific details about the exact manner in which language can be used by the individual, providing helpful guidance to clinicians and parents for designing and implementing MAN training activities, or any verbal behavior training activities. So let's look here in the first column. You see the basic repertoire assessment. This is the behavioral language assessment created by Sundberg and Partington. And this is a tool, it's a basic language repertoire assessment designed to quickly give parents and clinicians a starting point for beginning communication skills, such as Echoics or MAN, stacks, and Intraverbals. This assessment may be a good option to use in order to get a quick snapshot of the current skill level in regards to Manding or other verbal behavior skills prior to implementing a treatment plan. And in the second column, you see a comprehensive skill assessment. The first is the skills assessment. It's a component of skills, and it was developed by the Center for Autism and Related Disorders, and it offers a comprehensive skill assessment and curriculum analysis across all areas of functioning. Next, you see the ABLES R, and this is a skills assessment developed by Sundberg and Partington, which again is more formal and it's an in-depth skills assessment. And finally, the VB MAP, developed by Mark Sundberg, is another option of comprehensive skill assessment, which provides detailed analysis of an individual's use of verbal behavior. It may not be necessary to implement one of these assessments prior to starting verbal behavior training. However, it is recommended that an individual's current skill repertoire be closely examined to establish baselines and a guidance for developing interventions. So as such, the use of these assessments can be very beneficial to ensuring success and tracking progress of verbal behavior development. So once if you're going to use the verbal behavior approach for developing vocal speech, you need to do a few things before teaching even begins. First, you want to refer to typical language development as a curriculum guide. So you're going to want to refer to what is typical pronunciation for your child's developmental or age level. And then also you want to identify what types of words are being said, what type of speech is being used, as well as if you have a very young child or an early speaker, even looking at things like how many syllables is typical for this age level. And this is useful for selecting initial targets. And Skills actually has a lot of this information built into all of their verbal behavior programs. You also want to identify potential reinforcers. You'll see as we move along that many of these reinforcers are also going to be targets, so that's a consideration. And you also want to establish control over your reinforcers. So get that environmental control. Make sure that mom and dad are not giving access to the reinforcers outside of sessions. Talk to therapists about limiting the access to reinforcers and having a wide variety of reinforcers available to make sure that motivation remains high throughout sessions. You want to plan to teach in a naturalistic environment if possible, but you may also need to teach in a more structured setting. And parents and caregivers should be trained to use all of these strategies early on and should be using them while you're introducing them with the child as well. So having the parents participate in sessions is a wonderful way to get that training done. So the strategies we'll look at for vocal language development are manding, pre-operant reinforcement, pairing procedure, motor imitation, echoics, and basic Intraverbals. We are going to be looking at just the very beginning use of these. These can get extremely complex as they move, as we move through a program for a child. But today we're going to be looking for early speakers. So we're going to be looking at just the very beginning use of these. Another thing to keep in mind is that verbal behavior is the application of the principles of human behavior to language. So really, all ABA strategies are available, and many other ABA strategies may be useful while you're teaching. The first thing we'll look at today is manding. And as I said before, you can think of manding as a demand or a request. Technically, it's a verbal stimulus controlled by a motivative variable or establishing operation with a reinforcer specific to that motivation. So basically, it's asking for a specific reinforcement, and that can be positive or negative. I talked about asking for mom to cheer or attend, like, hey, look at me, or asking for something to be removed. Hey, turn down that music. You don't have to say hey. Children request things in some way almost immediately from birth. So we think about new babies crying. They're communicating that they're uncomfortable or they're hungry. Often babies, when they're overstimulated, will turn their head to the side. That is also verbal behavior. That's an example of a man saying, I'm overstimulated. I don't want, I need to look away at this point. Children with little or no language skills typically also find some way to request. So even when children don't have language skills, they'll find alternative means, and oftentimes that's not, it's not a very appropriate means of communication. It might be a maladaptive behavior, protest, hitting, that kind of thing. And typically developing children mand constantly. So manding is a huge part of, it's a huge part of our language. Many of the things we say are mands, and if you're around little kids, they really are manding all the time. Mands can be made in hundreds of different ways. So the topography, what the mand, the form of the mand can look like a million different things. It can be turning your head away. It can be pushing an object away. It can be reaching for something or screaming or hitting. It can be using a sentence. It can be using a gesture or a word or a sign. It's really endless. And mands also can be made for all sorts of things. And some of the mands that we see young children making are mands for objects, activities, for specific people, for attention, and that would include recognition as well, like look what I made, and for assistance and cessation, and also for information. So Here we see a picture of a child crying. In this picture, I skipped the video because I don't want you guys to listen to a crying child. But in this picture, the child's crying is functioning as a man for his bottle. Here we have another example of a vocal mand. In this example, it's a vocalization and a gesture that function as a man for the bottle. So in that video, the child reaches for the bottle and says, ah, and is given the bottle. Because he's given the bottle, it's socially mediated, that is functioning as a mand. Here we have an example of an impure vocal mand. So it's a mand paired with an echoic. The child's gesturing, and he's being vocally prompted to say the word up as a mand for being picked up. So let's look at manding a little more carefully because it's one of the most important elements of early spoken language training. The mand is controlled by a motivative variable. It is the only verbal operant controlled by a motivative variable. And what that is something that increases or decreases the speaker's desire for certain things. Oftentimes when we talk about the motivative variable, we refer to a physical state. So being cold or tired or hungry or finding something too loud. But it's not limited to a physical state. The mand, also called the motivative operant or establishing operation, loosely can be considered a state of deprivation or satiation. So if a child has had unlimited access to cookies, they might not be very motivated to use cookies as a reinforcer during their sessions. They might not really care about doing the activities because cookies is not motivating. Just like when you've had a giant Thanksgiving dinner and then had a giant Thanksgiving dessert, when someone walks in with another pumpkin pie and says, guess what, pumpkin pie, you're not that motivated to have any more. In that case, you're in a state of satiation. On the other hand, if you've just spent a week backpacking, living off of dehydrated backpacking food, and you come home and you're driving home, something that might normally not look appealing at all to you, like Taco Bell, for example, might look extremely good after having a week of food that you don't consider very good because you're in a state of deprivation. So that can also have an influence. The motivative variable alters the value of the reinforcer. It makes the reinforcer more powerful or less powerful. And although we talk about deprivation and satiation, there are a few other factors. For one, part of it just has to do with personal preference. So one example I like to use is if you're at the makeup counter and you're going to buy some new lipstick, and the sales lady says, oh, well, guess what? If you buy $25 worth of stuff, we have a free gift pack for you. That might motivate you to spend more than you typically would spend. You came in just for the lipstick because you're motivated by getting the makeup. If you then look over at the display case with the free gift pack and notice that all the makeup colors in the display are colors you would never wear, then that might change your motivation. You don't care anymore. You don't have a preference for the colors of makeup in the gift pack, so you're no longer motivated to spend more than you would on your lipstick. The mand is also the only verbal operant which leads to specific reinforcement. Specific reinforcement is reinforcement that satisfies some motivative variable relevant to the response. And specifically, it is the identification of what the child is requesting in their request. So saying juice is reinforced with juice. That's not always true because sometimes we have mands where the listener, the person in the listener role, may not be able to understand what the person is specifically asking for. So if they're hitting you or if they're gesturing to something that you can't tell what it is, in those instances, you wouldn't know specifically what they're requesting. However, they have an idea of what they specifically want. So there still is a request for specific reinforcement. And if you're able to respond to that, to mediate their request, then you would be able to provide specific reinforcement. So another example would be saying what time is it is reinforced with the response, it's 3 o'clock. Because the child receives specific reinforcement, demand is extremely motivating. You're asking for something and you get what you ask for. So it's really the most important verbal operant to teach initially because it, one, allows the child to specifically request things, so they're not requesting for general things. And two, it's allowing the child to tell you exactly what is going to be the most reinforcing thing for them. They're requesting what their reinforcement. At the same time, the child's language is getting reinforced by getting exactly what they want. So it's a little different with like an echoic where they're echoing something. There's no reinforcement built in, and you're guessing what the most effective reinforcer might be in that instance. With a mand, they're telling you. So when we look at manding, we talk about the mand contingency. And so let's look at that now. Here we have no reinforcer in place. However, the individual is experiencing a certain motivative state, or EO, and at this point, they don't have their reinforcer in place, which would relate to that motivative state. So for that reason, the person emits a mand response, and that results in the person gaining a reinforcer specific to the establishing operation. And once the reinforcer is gained, it satisfies the motivative state, and the individual or reduces it or eliminates it. So you can either satisfy the request and eliminate it entirely, or you can reduce it. Let's look at that with a real-world example. Jamie does not have any milk at the moment. Jamie has not had any milk today, so she's in a state of deprivation for milk. Jamie says milk, or reaches for the cup, or cries, etc. There's a lot of different things she could do. Jamie receives the milk in response to this mand, and after receiving the milk, Jamie no longer wants milk. So as I said before, manding should be one of the very first skills that is taught. Appropriate mands lead to significant decrease in inappropriate mands, including problematic behavior, and that's been demonstrated multiple times in research. Research also shows us that a manding repertoire facilitates the acquisition of other operants when compared to learning tax or labeling first. So remember I said that each verbal operant needs to be taught separately. However, they've compared language acquisition when you teach tax or labels, so just a picture, what is it? It's a dog, as opposed to teaching manding, so requesting for like a toy dog or whatever first. They've compared language acquisitions, and they've found that if a child learns to request for an item first, they're more easily able to learn to label that item. Whereas if they learn the label first, they're less likely to spontaneously or easily learn to request that item. For example, if they learn to request juice, they're more easily able to generalize juice as a tact, or to be able to say juice when asked, what is this? And shown a picture of juice. So before we get started on mand training, we need to identify our potential targets. And in this case, because it's specific reinforcers, our targets are also our reinforcers. So we're going to identify the initial things we'll use for initial training. They should be highly preferred and frequently used. They should be items and activities. It's really important very early on to incorporate activities into your manding training. Otherwise, we see kids who will just have a class of just item mands. And it can be hard to, it's easier to teach both concepts simultaneously, I think. Items should be easily given and easily consumed, so you don't have to sit there and wait while something's being consumed or used up. And you should choose activities that have, when you're using activities, something that has a beginning and an end. For example, handing the child a bubble wand, they can blow a bubble, or you blowing a bubble. The bubbles are going to pop. It's going to come to an end. Items also should be relevant and functional to the child and their immediate needs. As therapists, it's very easy for us to come in with a big bag of tricks and fancy toys, but if we're teaching Manding for just those items that we're bringing into the environment when we're there, we're not really giving them any functional tools. You want to make sure that your Manding targets come from the child's actual environment at home, things that are part of their day-to-day. You want to select initial targets based on language development, as I said before, so consider their age, consider typical pronunciation, mean length of utterance. Response form is another consideration. For very young children, we're not going to see vocal Manding yet. So if you're teaching Manding skills to a very, very young child, you might be looking at gestures rather than vocalization. You want to choose words that a child can already say or approximate. And initially, you want to avoid words that sound alike, so you wouldn't teach ball and bell simultaneously. Sounds or word approximation should be paired with items which closely resemble the actual word. So if a child's not ready to say book, you might introduce the word ba, or the sound ba, for book. Ultimately, the goal is for the child to say book, so you wouldn't want to introduce something that doesn't sound anything like book because it's going to require a lot more shaping. You'll select targets for specific items rather than generic words or phrases. And this is one of my biggest pet peeves. I know so many children that learn more and eat and a few other things like that. And then that becomes their primary vocabulary because they're easy and they can be applied to a bunch of different things. So instead, even though it's going to mean more work, you want to work on specific targets like apple and cookie instead of teaching eat or more. And you want to, another important aspect of that is that you really are better able to satisfy the child's request when you know that they're requesting something they specifically want. Eat or more can be generalized, can apply to multiple things. And so that can make the child less motivated and less reinforced because you're not able to specifically meet what their request is. Also, you want to avoid overgeneralization of man frames. So instead of teaching I want, like for example, that's supposed to be pushing, I want pushing, you might teach the child push me, or even just push. When I teach Manding, I like to teach at least 10 or 15 action words, just verbs, as a man before I introduce any man frame, because I find that many man frames, like I want, they become way overgeneralized, and it becomes grammatically incorrect, and I find it's easier to bring it in later, and more important to get the child requesting the different things that they're able to request for up before introducing man frames. I also like to introduce multiple man frames at once, so that the child isn't learning just one thing and becoming overly dependent on it. So we'll look quickly at early MANs, and this is all from the skills curriculum. And the skills curriculum has a beginning Manding program, but it also has a number of other Manding lessons with multiple targets. And so most of these are coming from the beginning Manding lesson. From 0 to 12 months, we see a child Manding for cessation by resisting when others try to take away their toy. They make protests using gestures. They shake their head to indicate what they would when they would like an activity to cease. For Manding, in response for yes and no, you'd see nodding head to indicate yes and shaking head to indicate no. And then for Manding for actions, objects, and people, oftentimes at this age you see gestural NAMs. For a 1 to 2-year-old, Manding with cessation involves using protest words, no or stop, all done, or no pushing or no TV, so no object or activity. When Manding for actions, they're Manding for both their own actions and the actions of others. So they might say color when they're requesting to be able to color, or they might say hug when they want someone else to give them a hug. And they're using a one-word utterance like up or out. When Manding for objects, they do request with the word more, and this is one of those times where I would say maybe skip this and come back to it a little bit later once you have a large Manding repertoire established, just because it can get overused. They request edibles when they feel hungry. And they request for mama and dada and usually two or more people, calling two or more people by their name. And then when using yes, no, or no in Manding, they respond with yes or no when asked if they want an item. And then finally, from 2 to 3 years, we see a child able to use sentences when speaking, and they make requests for an event to occur again. They also mand for actions of their own and others, and they make requests for those actions. They can make requests for assistance and request items using object names and request with and without objects present. We're not going to go past 3 years. However, the skills curriculum goes up to age 8. But we're not looking at that level of Manding. So another thing to consider when teaching Manding is to consider the response demand. Oftentimes, we are teaching Manding as a replacement for inappropriate behavior. So that means the child might be in a heightened emotional state when we're trying to have them mand. So for example, if we want a child to ask for something and they're used to screaming for it, we want to consider having a response demand. So what their response is to be less demanding or less difficult for them than the problem behavior that they're using, screaming, for example. Gross motor responding is typically considered easier than vocal responding. So teaching a motor request, for example, pushing an object away or exchanging a no icon or a break card, and eventually shaping that to a vocal response might be an appropriate way to start with Manding. You also want to consider that when teaching the, what your mean length of utterance expectations are and that sort of thing for Manding. Also, you want to capture and contrive motivating operations throughout the day. First, you'll need environmental control, because that means motivational control, having control over the reinforcers in the environment. And then initially, you're really going to want to contrive as many opportunities to evoke mands as possible, because naturally arising situations typically are not sufficient or frequent or sufficiently frequent or varied enough to teach initial Manding skills. You want your sessions to be extremely rich with Manding opportunities. And then also you want to capture appropriate opportunities for mands for cessation. So actual times where it's okay for the child to escape a task or an activity. So for example, maybe giving them a chance to refuse a food that they don't like. You want to conduct frequent preference assessments. So don't ever expect a child to mand for objects or activities that they do not find reinforcing. And along those same lines, you never want to prompt a child to mand for something that they don't actually want. Confusing for the child, and it's also not motivating at all. It can be punishing. And of course, you want to train caregivers. Because typically developing children mand from very early on, the social component is very motivating, and we see manding happening at such an early age. Our children are really trying to catch up with something that some children have been doing for such a long time. So we want to give them as many opportunities as possible, and that means making sure that their caregivers are trained as well. You want to make sure that all the people working with the child know how the child requests so they don't miss a request, because our children might not be using a typical request or response form. And you want to keep all people working with the child apprised of the complexity of the requesting form. So if the child used to be saying ba as an approximation for book, but now they're saying book, we want everyone to know that, because our kids are smart and they will figure out that they do not have to say book if they don't need to. And parents should also be trained to set up situations throughout their day that are going to evoke mands outside of therapy sessions. So we've talked about manding, but that assumes that your child is vocalizing. What do you do if your child isn't vocalizing at all yet? In that instance, you would use pre-operant reinforcement and also pairing procedure, and we're going to look at both of those now. So Free operant reinforcement of vocalizations is used to increase the frequency of vocal behavior. And you can use it throughout your therapy sessions. Parents can also be trained to use this. And when used appropriately, it will increase the probability that echoic behavior will be acquired. What it looks like is that you're going to, in your session, reinforce any spontaneous vocal sound that the child makes, regardless of the circumstances. So that would be any vocalization. And it's very child-specific, so you may choose to limit some sounds that are being reinforced. For example, you may choose to not reinforce vocal stereotypy or screams or protests. You also may want to choose reinforcement that sounds similar to vocalization. So if you notice your child making specific vocalizations, ba, for example, you might choose to reinforce that with bubbles. That gives the child the idea that, that sound seems to be paired with getting bubbles, and it's creating shaping. It's kind of pre-shaping the target. And then also you may choose to use expressive follow-up to label the reinforcement. So for example, your child is playing and they say ba, you would come over and give them the bubbles, and you might use expressive follow-up and say bubbles while you're providing the reinforcement. That reiterates the connection between the sound ba and bubbles, and also the word bubbles. So let's look at this using the three-term contingency. When you're using free operant reinforcement, there's no reinforcer in place, and the child doesn't have a motivative variable in place either that you're necessarily aware of. The child will make a spontaneous vocalization, and they will receive a non-specific reinforcer. So they're not asking for a specific reinforcer. They're not asking for something with their vocalization. If they were, that would be manding. This is just a spontaneous vocalization that occurs. So for example, Jamie says ba, and Jamie receives tickles. So it could be some reinforcement that doesn't sound like the sound. Or as I said before, Jamie says ba and receives bubbles. The reinforcer could be similar sounding to the vocalization. So in this video, the child is engaging in vocal stereotypy. They're saying ticka, 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 and they're going to receive free operant reinforcement of tickles. So after receiving tickles, the child engaged in another vocalization, a duh sound, and they received a book with donkeys. And expressive follow-up was used for both of those. So free operant reinforcement can be used simultaneously with other targets. You can use it when you're teaching all those other things we talked about, and use it with pairing. So echoics, motor imitation, and manding is fine. It's a wonderful way to learn the types of vocalizations that the child is able to make. So if you hear the child making a specific sound, you then are aware that they are able to make the sound. So when I'm using free operant reinforcement, I ask that my therapist record the vocalizations that are being made and just take note of them so we learn what sounds the child is able to make. Caregivers also should be taught to use the strategy. So we want everyone to just be reinforcing the child and increasing the number of vocalizations that they're making. And for data collection for this, a clicker counter is a really useful tool. You'd obviously want to start with some baseline frequency to just make sure that your free operant reinforcement is effective. So moving on, another strategy that you'd use for increasing vocalizations is stimulus-stimulus pairing procedure. And this is used to establish target vocalizations as reinforcers. So with free operant reinforcement, there wasn't any target vocalization. You had identified reinforcers possibly, but you wouldn't have target vocalizations. The child is just making vocalizations. In this case, you will have target vocalizations. However, the therapist or caregiver is going to be saying the target vocalization while simultaneously providing the child with a known and it can be learned or unlearned reinforcer. So the child's not doing anything here. You're vocalizing and you're providing the reinforcer. So for example, the caregiver says, E, and gives the child a cookie. They're trying to make sound E reinforcing to the child. You want to choose reinforcement that sounds like all or part of the vocalization. So E sounds like the end of cookie. And the child is not required to vocalize in order to receive the reinforcer. So again, this is all on the part of the therapist or caregiver. The target vocalization is going to acquire reinforcing value through pairing with an established reinforcer. So you're making that sound reinforcing to the child. You're also creating an association between the sound and a reinforcer. So in this case, there's two ways that you can do pairing procedure. The first is what I just talked about. There's no reinforcer in place and there's no motivative variable. And the caregiver is going to model a vocalization and provide, it should be non-specific reinforcement. So that's an error on the slide. And that's true for both of these examples. Or no, it's not for this example. The one above, the child may have a motivated variable in place, and they may engage in a non-vocal response. For example, reaching for something up on a shelf that's out of reach. The caregiver would then model the vocalization and provide specific reinforcement. So the child's identified, they made a man using a gesture, and you're going to respond to their man, give them the specific reinforcement, what they're asking for, and model a vocalization. And in that case, it's kind of pairing / manding and shaping. So for our first example, there's no motivated variable in place. Dad says, and gives Jamie a book. In our second example, Jamie wants bubbles, and he reaches for bubbles. And Mom says, and gives Jamie the bubbles. And Jamie no longer wants bubbles. He has them. Here we have an example of pairing procedure. The adult is vocalizing ba while giving the child a reinforcer, a balloon. So it's something that sounds like the actual word balloon, and the target vocalization is ba. So in that case, the child made a vocalization after receiving the balloon, and that is something that occurs with pairing procedure, and it's one of the reasons that we use it. Anytime the child randomly emits a vocalization that resembles the target vocalization, you want to also be reinforcing that vocalization immediately. So kind of the pre-operant reinforcement, but now we're doing it with specific targets. And once the child's able to produce vocalizations consistently, you want to move on to man training. So if your child is able to imitate the vocalization or is consistently saying it throughout the session, you're no longer going to use that target in a pairing procedure. You're going to move on to man training, and you're going to require that the child make the vocalization or an approximation of the target sound in order to receive the reinforcer. If you continue to leave it in the pairing procedure, the child's going to lose their motivation to say it because they're basically getting it for free. So you have to take it out of the pairing procedure and move it into manning. You want to refer to typical pronunciation and language development, as I've said before. And some things to keep in mind when selecting targets. Vowels are typically developed first, and they're less likely to be misarticulated. And vowel sounds such as E, I, and E, and A, and the consonant sounds M, B, and P, typically develop first. And targets will, these targets are also going to become echoic targets, and they're going to become man targets. So you want to think about all of those things we talked about for selecting manding targets when you're selecting these targets. This procedure can be used simultaneously with all the other strategies, as I said before, including manding if there are targets available. And caregivers should definitely be taught to use this strategy, and they also need to be made aware when a target moves out of this strategy and into manning. So the next thing we're going to talk about, the next operant we're going to talk about is imitation. And I always think of it as motor imitation because imitation in the verbal operant is copying another person's motor movement. So that would include just copying play with imitation of gross motor or fine motor, or it might include imitation of interaction with an object, like banging on a cup, or it also would include the learning the production of signs for sign language and imitating oral motor movement, so sticking out your tongue or pursing your lips. Motor imitation or imitation is extremely useful for teaching the echoic repertoire. So remember, echoics are vocal imitations or echoing speech, because motor imitation teaches children to attend. So it teaches them to attend to another person, to pay attention to what they're doing, and it can teach oral motor imitation. So teaching the child mouth placement for certain sounds. For example, pursing your lips for or smiling for e. Vocalizations, when you're using oral motor imitation, vocalizations can be paired, or you can use them as expressive follow-up. So if you're teaching the child to imitate a smile, and you say, do this, you can make a smile face and pair it with the sound e, or you can smile for the child, and when they imitate you, you can use part of your expressive follow-up and reinforcement. Yeah, that's right, e, and demonstrate again how the smile can be paired with a sound. The goal with imitation is that it's spontaneous, it's immediate, and it's fluent. So really, we want a child to have an imitation repertoire that's completely fluid. You can throw out anything developmentally appropriate and physically within their capabilities, and they can imitate it. But one thing we found with imitation is generalization does not necessarily occur across different topographical response classes. So you might have a child who's completely fluid with fine motor imitation. They can touch their head, they can jump up and down, they can reach the floor, but that doesn't mean that they're going to be able to imitate fine motor actions or oral motor actions. And so typically you're going to need to teach across each of those. Again, this is one of those things that should be targeted simultaneously. It really should be a very, very beginning lesson for any program where a child is not using vocal speech. So here we have the imitation in the context of the three-term contingency. The therapist makes a motor action, the response is that the child does the same action, and they receive non-specific reinforcement. So they're not requesting anything specific. For example, the therapist waves their hand, Jamie waves his hand, and Jamie receives tickles. Those are reinforcements. In this example, the child is engaging in oral motor imitation of opening their mouth. However, this is not a stellar example. There's no reinforcement taking place, and you can see the child getting frustrated. So here we go.
Do this.
So after teaching imitation, next you're going to move on to echoics. And echoics is vocal imitation. It's repeating or echoing another person's speech. For example, saying mommy after someone says mommy. It includes sounds and words and phrases. And initially, you're going to obviously start with sounds and work your way up. It's very difficult to teach vocal language without developing an echoic repertoire. All children have difficulty making certain sounds, and echoics is one of the ways that we teach that. So even though we're teaching Manding, and that's absolutely critical for developing motivation, the motivation to speak, we also need echoics because it's useful in developing speaking skills. So when you're teaching echoics, you're going to use shaping and chaining to develop and string together speech sounds into words. You might start with buh, and then bub, and then bubbles. And then eventually maybe that turns into blow bubbles. And then also you want to target echoics simultaneously while using free operant reinforcement and pairing procedure. And you might be working on some of the same sounds for all of these. So here's an example. The therapist says, a sound, word, or sentence, and the child says the same, and they receive non-specific reinforcement. So Dad says dog, Jamie says dog, and Jamie receives bubbles. For children who have a very limited echoic repertoire, so kids who are have no echoics or just a few, this is the steps you're going to take. And this, again, comes from the skills curriculum. The therapist is going to make a sound paired with the presentation of a reinforcer. This is a little different. For example, they might present bubbles and say, buh, buh, buh. And if the child makes any vocalization in response, so it doesn't have to be a buh sound, it can be anything, the therapist is going to provide that reinforcer for the child. In this example, blow bubbles. Here we have echoics, and we're pairing them with a reinforcer to increase the child's motivation. And again, as I said before, you want to refer to typical pronunciation when language development. And then you also want to select targets that are being used in pairing procedure or targets that have been identified during pre-operant reinforcement. So that list that you're taking of sounds that the child is able to make, those should be initial targets that you would use in echoics. As soon as the child is making any vocalization in response to your vocalization, you're going to want to start shaping that sound and introducing more specific targets. Once the child has the concept of echoic, so you say something, I say something back, you are going to want to move on to teaching specific sounds. So when you're teaching initial sounds, the therapist will make a sound and the child imitates as the response. So the therapist presents bubbles and says buh, and the child says buh, and the therapist blows bubbles for the child. You don't necessarily have to pair an object, as the example is here, but it's been found that consistently pairing a sound with an object or visual associated with the sound, especially one that's reinforcing to the child, may aid in acquisition. When you're choosing visuals, initially you want to select reinforcers. However, once the child's echoic skills is developed, you may want to use visuals that are just associated with the object. For example, a picture of the dog that's not necessarily reinforcing to the child. And then occasionally you want to target without those visual representations in order to ensure that the child's not dependent on them. You want to make sure also to review auditory discriminations and phonemic awareness if your child consistently is making errors. For example, if they always make a duh sound in response to buh, you might want to review, there's a minimal pairs lesson in skills, and there's reviewing those auditory discriminations is definitely useful for helping the child discriminate between the two sounds. Once the child's able to make sounds, you're going to move on to blends. So consonant-vowel blends like ma, vowel-consonant blends like up, consonant-vowel blends like dada, consonant-vowel different consonant-vowel blends like nana, and then words like banana. And all of this will depend on the age of your child. Here's an example of a child using the word, or using an echoic of the word dog in the natural environment, and in this case they're also looking at pictures of a book of dogs. Dog. So the therapist said dog, and the child responded with dog. The last verbal operant we're going to be talking about today for early speakers is the intraverbal. And that is, like I said before, a social exchange, or sometimes we refer to it as conversation. The intraverbal is a response that's controlled by a vocal stimulus that does not match that stimulus. So, the reinforcer for an intraverbal is nonspecific. So basically, it's I say something and you say something back dependent on what I said, but not the same as what I said. And as I said before, typically answering questions or having conversation encompasses intraverbals. So saying she's good because someone else says, how's your mom doing? This skill is particularly difficult for children with autism, and it's especially important because we know conversational skills are something that our children struggle with down the road. The reasons that intraverbals are so difficult, it's been hypothesized that there's a lack of specific reinforcement in an intraverbal, and that makes it less reinforcing for the child. Really, intraverbals, the reinforcement seems to come from the motivation of talking about a topic of interest and also the pleasure of social interaction. So if our child isn't talking about a topic they're interested in and they're not receiving reinforcement from having social interaction, they're not going to be as motivated to engage in intraverbals. It also explains why we see perseverative topics in older verbal children with autism. Intraverbals are also especially challenging because many intraverbals are made without a visual reference. So that requires the child to recall what's being talked about. We talk about things we can't see all the time, and that can be especially difficult. It also requires that the child make conditional discriminations. And conditional discriminations are where one stimulus influences another stimulus. So a verbal conditional discrimination, for example, might be if I said, define a vehicle. And so there's two relevant verbal terms, define and vehicle, as opposed to me saying define a food, or give me an example of a food, or give me an example of a vehicle. Again, there's multiple things they have to be able to discriminate. Vehicle and define, example and food. So here's an example of an intraverbal. The therapist makes the statement. The child says something different but dependent on what the therapist says, and they receive non-specific reinforcement. Kim says, how was your vacation? Jim says, not long enough. They're receiving specific reinforcement by talking to each other, or non-specific reinforcement by talking to each other and talking about a topic of interest. So early intraverbals for early speakers, we're not getting into any of that conversation yet, but it's still something we can teach our very, very young speakers. And typically developing speakers begin using intraverbals very early, often in the context of interactive play. So some examples for a 1.5 to 2-year-old would be singing songs, row, row, row your, and the child fills in the word boat. That's what the child's saying is dependent on what was sung, but different. So that would qualify as an intraverbal. Animal and object sounds, train goes, and the child says choo-choo. Again, would be an interverbal, or who says moo. Fill-in phrases and anticipatory routines. So ready, set, and the child says go, and the parent responds. And anticipatory routines could be a whole separate presentation, but basically that's any play activity where the parent pauses, gives the child a chance to respond through gesture or vocalization in order to continue the play. And that pause often leads to a vocal response. And then also, at 2 years, we see children responding to simple questions such as what is your name, fill-in responses, or fill-in phrases like I love you, and word associations, mommy and daddy. So Sundberg and Michael hypothesized that the motivated variable has a critical role in developing early interverbals for children with autism. And this goes back a little bit to the anticipatory routine. And they found that when you're teaching early interverbals, you want the response to be part mand and part intraverbal. So an example would be row, row, row your, and there's a pause. Jamie's motivated variable is that he wants the song to continue. So he says vote. He's not only responding to the interverbal, he's also requesting that the song continue or the play continue. And that would be a mand intraverbal. And then he's being reinforced, specifically reinforced in this case, by continuing the song gently down the stream, and his need is being met by getting specific reinforcement. The motivative variable has been satisfied. When you're teaching early interverbals, the therapist is going to present a vocal stimulus, and this is actually a combination of multiple lessons from skills, but just for the sake of time, I condensed them into one example. And the child says, let's sing or say, and you could do a song or a rhyme or a phrase. And then the therapist delivers part of that song followed by a pause. The child would fill in the correct words or sound. For example, let's sing Twinkle, Twinkle, Little Star. Twinkle, twinkle, little, and then there's a pause, and the child responds with star. Initially, you want to emphasize any attempt to vocally respond, not the actual lyrics. So if the child says, ah, that would be reinforced as well. And with all of our sounds, you're going to shape words over time. And you want to use expressive follow-up if appropriate, or if you feel like that's appropriate for your child. It may be used after the child's response to reiterate the correct response. So in this case, you'd never want to use expressive follow-up as a correction. It would be used as part of your reinforcement. So if the child says, ah, in place of star, you could say, that's right, star, and then continue the song. So they're being reinforced for what they said. You want to vary when the pauses will occur within the songs in order for the child to respond with a variety of words that are in the song. You don't want them learning to just pause at all the same places in the song. And a great benefit of this is it teaches them the songs as well. And if you're not sure what songs are interesting to your children, playing music throughout their day and engaging them in a variety of anticipatory play activities, rhyming, games, that kind of activity can increase their interest and help them develop preferences for specific activities. Some examples, or early interverbals should also be targeted only when the child maintains an interest. So because that demand component is so critical for teaching this, you don't want to continue the activity when it's not motivating for the child anymore. Here's an example of a child using a simple interverbal, and it's a manned interverbal. It's a vocal approximation of go in response to ready, set. Ready, set, go! And there you can see expressive follow-up was used as well. So now we've talked about the different verbal operants used when teaching initial speech. And I want to briefly also discuss augmentative and alternative communication in vocal speech. And that's because oftentimes we'll see parents being resistant to the introduction or use of AAC when with early learners. And sometimes parents are concerned that this means their child's never going to speak. And research shows that that's not true and that it can have some benefits. But I want to briefly review that. So augmented communication is any device or method or system used to supplement speech. So for example, I talked about using a break card or a visual that's either paired with vocalization or used in place of vocalization for a specific part of the child's vocal speech. You also have alternative communication, which is any device or method or system used for communication when speech is not developed or has been lost. So this is in replace of speech. It's not augmenting, it's not taking over bits of speech. That would be gestural communication or sign, which can be used as an augmentative communication as well. And then we have low-tech methods such as communication boards or PECS, and high-tech methods like an iPad or voice print output devices. There's many reasons we would use AAC with a child. One would be a child who's not developed vocal speech, a child who has poor articulation, who's has unintelligible vocal speech, a child with limited vocal speech or small vocabulary. We might also use it for a child who has a very strong tacting repertoire and a poor manding repertoire to help develop those manding skills, and for children with poor emotional regulation. So a child whose aggression or destructive behaviors, when they're frustrated, make it impossible for them to use vocal speech. Using AAC can help bridge that gap and shape vocal speech down the road. One of the most common AACs we see with young children with autism is the introduction of the picture exchange communication system. And it's often used as initial AAC, either adaptive or augmentative. It is an iconic communication system, and in the system, the child exchanges pictures or icons of specific items with a communicative partner who replicates the role of the listener. It was developed by speech therapists, and it's been empirically validated by behavior analysts as a method to teach communication. There's multiple phases in PECS, and each of those has been researched. PECS is a means of spontaneous communication. So when used appropriately, it is not prompted. The child spontaneously selects an icon to exchange with a communicative partner, and that exchange is a replication of vocal communication. PECS is not a picture schedule, and it's not a choice board. The exchange is a key component of PECS, especially for behavior analysts. It is a physical exchange of an icon. So as we said before, they're going to pick it up, they're going to hand it to, they're acting as a speaker, and they're handing that icon over to a communicative partner. And that exchange replicates the effect of speech on the listener in a vocal exchange by showing them the icon. They're showing them what they want. And the initial phases of PECS begin with teaching manding or requesting. So why would you use text? It's inexpensive, so it's an easy place to start. It's very easily personalized. You can use real pictures or iconic, like board maker icons. And you can actually even use real objects if you want. I've seen PECS systems with real items in like a clear Tupperware, for example. It's simple and adaptable for listeners and speakers, so it's logical and easy to understand. It's a great prerequisite for a child who might be considered for a voice output device, and it doesn't require imitation or fine motor skills. So it's a little easier than sign. It has less demand on recall and recognition, so the child has all their vocabulary there in their PECS book, their communication book, and it's pretty universally understood. I've had clients who've been able to order at fast food restaurants and stuff using their communication book. And PECS can be taught using the verbal behavior framework, and this is a huge one. So you can teach manding and tacting and intraverbals with PECS. So here's what PECS would look like with a mand contingency. There is no reinforcer in place. Jamie wants milk. Jamie exchanges a milk icon or a milk icon on an I want sentence strip. So basically it's a sentence strip that says I want, and you put the milk icon on the end, and he says exchanges the whole thing. And Jamie receives milk and no longer has a motivated variable for milk. Some studies show increased speech development over time by using PECS. And the most well-known is Charlotte Christie in 2002. They used PECS to teach children, to increase vocal speech in children, and specifically manding. And what they found is that it did increase vocal speech. It increased social communicative behaviors as well, and it decreased problem behaviors, which is understandable because the children were being able to ask for what they wanted. In this study, they used a 3-second delay between the exchange and the response. So in PECS, when an icon is exchanged, the communicative partner typically would look at the icon and then respond by saying what the icon says. So if you handed me an icon with French fries, I would look at it and say French fries. Or if there was an I want strip, I'd say I want French fries. They put a 3-second delay between the exchange and the response, and they found that this seemed to be a key component of developing vocal speech because just those 3 seconds were enough time for the children to want to say it, to vocalize their mands, their requests that they had made with the PECS themselves. And eventually they were able to fade the PECS, the communication system, and the children were able to use vocal speech. That being said, the empirical evaluation of PECS for teaching vocal speech is still limited. There's research the research is really mixed as to whether or not it really increases vocal speech. However, the good news is we know it does not. The research suggests that it does not in any way inhibit speech development. So introducing PECS is not going to be something that harms the child's speech development or delays it. It also appears to decrease challenging behavior, and that has a positive effect too, because it can provide more time spent during sessions working on teaching rather than addressing challenging behavior. And it seems to have a positive effect on social communicative behaviors, which makes sense too because it is a social communicative interaction. It's an area where we definitely need further research, especially to determine what are the salient elements of PECS. Is it only the exchange? Is it just the 3-second delay? Are there aspects of PECS we can use when teaching language that don't necessarily, when we don't necessarily need to teach PECS? So I've had many, many clients that have started with PECS as part of their program and have gone on to use vocal speech. For parents, they shouldn't consider the introduction of PECS as a sign that their child will not speak. And sharing that research article with them can be helpful for parents as well. So in summary, today we discussed verbal behavior and the number of strategies that it offers to promote the development of vocal speech. Specifically, we looked at initial manding, the use of free operant reinforcement and stimulus pairing to increase vocalizations, Echoics, motor imitation too, it's not on there, and Intraverbals. And we also briefly reviewed augmentative and alternative communication devices and noted that PECS may be an effective option for developing vocal speech and, most importantly, does not appear to inhibit the development of vocal speech. I want to thank you all for joining me today.